بنرحب بالأستاذ الدكتور خالد عبد الغفار نائب رئيس مجلس الوزراء ووزير الصحة والسكان. الأستاذ الدكتور خالد عبد الغفار نائب رئيس مجلس الوزراء ووزير الصحة والسكان. السيدات والسادة الحضور الكريم، تحية طيبة لحضراتكم جميعا. في السنوات العشر الماضية كان ولا يزال قطاع الصحة على رأس أولويات القيادة السياسية، باعتبار أن الصحة أحد المحاور الأصيلة في ملف التنمية البشرية نحو بناء إنسان متكامل جسديا ونفسيا. وترجمت وزارة الصحة والسكان فلسفتها في رفع كفاءة المنظومة الصحية بتطوير البنية التحتية للمستشفيات والوحدات الصحية، وإنشاء عدد من المنشآت الطبية الجديدة على مستوى محافظات الجمهورية. واليوم ونحن نشهد المؤتمر الدولي الثالث للأشعة التشخيصية والتداخلية بحضور كوكبة من الخبراء على المستوى المحلي والإقليمي والدولي، تأتي مصر نموذجاً فريداً لاختبار التطورات الجديدة في معدات الأشعة من قبل أكبر مصنعي الأشعة في العالم. ونبدأ الكلمة مع الأستاذ الدكتور محمد فوزي مستشار الوزير والمشرف على الإدارة المركزية للأشعة، فليتفضل.
Your Excellency, Bismillahirrahmanirrahim, Your Excellency, Professor Khaled Abdel Ghaffar, Deputy Prime Minister and Minister of Health and Population, our esteemed delegates, our esteemed guests, I would like to thank you for attending today's opening ceremony for the third edition of the Radiology Conference for the General Department of Radiology. This year's conference, we will show, as we promised His Excellency Professor Khaled last year, that we will start I would like first start and emphasize on today's this year's conference. As usual, with this year's conference is organized in partnership with the Egyptian Society of Radiology. And before I start my presentation, I would like to first congratulate Professor Dr. Tara Dasti, President of the Egyptian Society of Radiology, for being nominated as the Secretary General of the International Society of Radiology and also the President-elect of the Pan-Arab Radiology Society. At the same time, I would like to congratulate Dr. Ahmed Shenouda, who is the Secretary General of the Egyptian Society of Radiology and was also nominated in the Radiology Society of North America to be the Regional Communication Committee for the Middle East and Africa. And these are figures that are now being renowned and known in the international society, and this is a true addition to us. In this year's conference, we were able to have 28 scientific sessions, 19 workshops, more than 2,000 attendees working in the radiology field, and 36 international speakers. So this year we are so much dedicated in seeing what's new, what's innovative, and our workshops, we're having new techniques in workshops. As an example, bowel ultrasound, which is the first to work in Egypt currently. As I mentioned, Your Excellency, this year we're going to show you what happened new in the radiology in the MOH since in comparison to last year. On slide. Okay. As we all know, this is the current structure of the Radiology General Department of Radiology in the Ministry of Health. We have the procurement, the teleradiology, the executive office, quality, the IT, the finance, administration, training, mobile units, and planning. So these are the current departments that are active, up and running currently in the MOH. What's new since 23 to 24 that was added as achievements? We started implementing the VNA, which is the Vendor Neutral Archive, and this is a platform that will give us complete access to all images from all hospitals who are connected to us, and at the same time, not depending on which vendor we have as a machine or which vendor we have as an archiving system. So this is a true addition to our service. It will help in implementation of easy radiology, easy teleradiology, and also research and patient retrieval of the patient's data. And I want to clarify that, to emphasize that this is the first VNE in all of Africa and the Middle East, actually. Our training centers technical training centers, we partnered, our first one installed, as we promised last year, is from Siemens, and it's in Ismailia Technical Institute, and it started up and running currently. We have a second one that was delivered already last month from Philips company, and we promised next year we're going to have 2 more technical institutes, simulation labs. This gives us a chance to train our technicians live on CT and MRI protocols, as well as 3D training facilities. We already worked a lot of effort. This was actually before 2023 on local production of ultrasound, and the MOH partnered and supported GE in order to be able to do this with the great effort of His Excellency Professor Khalid. And very soon, already we got the letter of intent from GE, and very soon it will be, we're gonna get the first patch of ultrasound. We got from the international IAEA, which is the international authority, the 2 radioactive mobile trucks. We already delivered these trucks. It was a donation from the International Atomic Agency, and they came as a donation, and we already took these cars, and we're going to start implementing them in the next 10 days or 2 weeks, and they are used to transport radioactive materials all over the country, and also removal of waste in a completely isolated pattern that is safe for the population and safe, and already it will be up and running in 10 days. Egypt currently, as His Excellency last year was in the conference, we became, for some companies, the center of validation, meaning that if there is a machine that is still not validated and not licensed to work and needs to do cases for research in order to get the license, Egypt became one of the sites in this, and we started actually by GE for its CT machine, the Aspire, which was still not implemented, and it was installed in Egypt, and we chose Qahira Fatimiyya Hospital to be installed in, and now it's up and running actually for more than a month now, and we're starting to gather data after the 6 months to give it to them in order to be able to get their international validation. So Egypt now became good grounds for validation for international companies. Research. Research is a big word. Now we have it on the ground with partnership with Canon as the first company. We partnered in to have the first ultrasound, which is called Aplu I-800, which is the first ultrasound to be present on the Egyptian soil, because it's a high-end machine and it only was for research basis. And we already delivered this machine. We're starting a research protocol on liver assessment, fat, and cirrhosis. And we're going to start active cases after its pilot, after finishing currently the ethical approvals for the research. But we have the machine now on site. We started an oral radiology department in the General Department of Radiology, and the main purpose of the oral radiology department is to start gathering all the data of the installed base present currently in the Ministry of Health, start putting the plan, and we are collaborating with the dental administrative department in the MOH in order to start this phase of re-evaluation of the oral imaging machines, because we already are permitting the license to them. So we're gathering all the database on it. So we already opened the department that is actually starting to work last week. Now this is the extra that we did, Your Excellency, in the General Department of Radiology, but this is parallel to the regular work that we do every day, our routine work. Concerning the teleradiology in 2023, we were connected to 65 hospitals. We reported 36,200 patients. Currently in 2024, we are connected to 94 hospitals and we reported 96,299 radiology images. With the reference to the quality department, which was started in 2022. Last year in 2023, we visited 5 governorates. In 2024, we visited 21 governorates with a full quality audit report for each hospital in each of the 21 governorates, with the reports for each hospital. In the training, from the training arm, in 2023, we trained 1,598 doctors and technicians. In 2024, up till now, we trained 2,460 radiologists and technicians on CT, MRI, and ultrasound, and echo. And these are images of the training that we did. The mobile units, which is one of the strongest added values for the Ministry of Health, because we are actually considered the leading country in implementing the use of mobile units. So mobile units are not just imaging backup trucks. No, we are implementing them all over the country. We have 4 mobile units, and these are our 4 mobile units that are currently present, and a 5th one, which is a mobile MRI. We have 4 mobile CTs and a mobile MRI, and they were launched since more than a year now. And in 2023, we did 7,551 examinations. In 2024, we did 12,191 examinations, because there is increased demand for this kind of service, especially in underserved areas and in hospitals that have problems with their machines. In the procurement, of course, we go through a big phase in partnership and collaboration with the UPA, and this is just an example of the volume of the machines that we procured till 2024. The Executive Office for Licensing, along till now, we did 1,977 license for machines, centers, and equipments. What's our vision? Our vision is to start, with Your Excellency's permission and, as usual, continuous support, to start an radiology AI department in 2 arms: our own national AI and collaboration with other companies and universities to implement our own AI. Encouraging PPP projects, which we have already potential projects, and we are working on them, whether on the local and international partners. And encouraging strategic stakeholders to increase the footprint and localization, which we are already touching base with Your Excellency's guidance in this. And to continue the MOHP improvement in its human resources, and we are very concerned about capacity building. And in this year, we're going to see a new, different era in training our staff, not just in the clinical part, but in the administrative part. And what is more important is increase our work in research. Thank you so much.
شكرا الدكتور محمد فوزي، مستشار الوزير والمشرف على الإدارة المركزية للأشعة. خدمات الأشعة المختلفة أحدثت طفرة في الخدمة الطبية وساهمت بشكل كبير في دعم خريطة مصر الصحية من جديد. ويعد هذا المؤتمر فرصة لاستكشاف أحدث الاتجاهات والابتكارات في الأشعة من خلال تبادل المعرفة والخبرات. والكلمة الآن للدكتور طارق الدياسطي رئيس الجمعية المصرية للأشعة، فليتفضل.
Assalamu alaikum. Your Excellency, Professor Dr. Khalid Abdel Ghaffar, Minister of Health and Population, dear Professor Mohammed Fauzi, Radiology Advisor for the Ministry of Health and Population, and board member of the Egyptian Society of Radiology and Nuclear Medicine. Ladies and gentlemen, dear colleagues, good evening. I'm pleased to welcome you all to the third International Radiology Conference of the Ministry of Health and Population, organized by the General Department of Radiology, GDR, in partnership with the Egyptian Society of Radiology. To enhance education and the training of our radiologists, technologists, and radiographers, we have established collaboration agreements with many international societies and organizations, including the International Society of Radiology, the European Society of Radiology, Royal College of Radiologists, French Society of Radiology, European Society of Neuroradiology, British Institute of Radiology, IAEA, and the Lancet Oncology Commission on Medical Imaging and Nuclear Medicine, aiming to promote cooperation and to expand partnership between us and these bodies. I can mention one example of our achievement. An educational musculoskeletal radiology course organized by the Royal College of Radiologists was held in Cairo just in the last 3 days prior to our conference. The Egyptian Society of Radiology and Nuclear Medicine takes upon itself the role of defending the rights of radiologists from the encroachment of other specialties on the specialty of radiology. Certain regulations and laws are required. As the Egyptian Society is not authorized to do that, we need the support of the Ministry of Health and Population in this issue. The Egyptian Society is honored to be partner of the first, second, and third International Radiology Conference of the MOH. I am grateful to the many experts who have come from across the world to share their valuable knowledge. I also welcome all representatives of radiological societies, organizations, radiology department, and industry associations who have joined us. Such an international congress provides a valuable chance for radiologists, industry specialists, and decision makers to share experiences. A glance through the list of presentations and workshops planned for the scientific program reveals an amazing diversity of topics. I would like to thank the scientific and organizing committees for their great efforts. Last but not least, I would like to thank the organizing company, BCO, and all of our sponsors. Your support is well appreciated. I am sure you will have a fruitful and rewarding program in the next couple of days. I wish you an enjoyable time and nice gathering during this important conference, in hope of your annual return for the coming years. Thank you so much.
شكرا الدكتور طارق الدياسطي رئيس الجمعية المصرية للأشعة. والآن ندعو معالي الأستاذ الدكتور خالد عبد الغفار نائب رئيس مجلس الوزراء وزير الصحة والسكان والدكتور محمد فوزي لتكريم بعض المتميزين من العاملين بالإدارة العامة للأشعة. الدكتورة سهام محمد فؤاد السيد السعدني. الأستاذة منال سيد مصطفى محمد. الأستاذ أحمد محمود عبد الرحمن. الأستاذ محمود عوني. الأستاذ محمد علي. الأستاذة الزهراء عبد العال. الأستاذ عبد الرحمن أحمد حسام. الأستاذ مشير فاروق. الأستاذ أمير عوني. الأستاذ عثمان محمد. الأستاذ محمد عبد المقصود. الأستاذ محمد رجب. الأستاذ محمد جودة. الأستاذ علي رجب. الأستاذة نادية رمضان. الأستاذ محمد عبد العظيم. الأستاذ محمود صبري. الأستاذ مصطفى علي. والآن يهدي الدكتور محمد فوزي درع الإدارة العامة للأشعة للأستاذ الدكتور خالد عبد الغفار. وختاما الكلمة للأستاذ الدكتور خالد عبد الغفار نائب رئيس مجلس الوزراء ووزير الصحة والسكان.
بسم الله الرحمن الرحيم. بشكر حضراتكم ان انتوا يعني قعدتوا متاخر لحد دلوقتي، وده معناه ان المؤتمر ناجح جدا. انا الحقيقه دايما بعجب بكم الحضور اللي الدكتور محمد فوزي والاداره الاشعه بتقدر انها تحشده من وزاره الصحه، وده اذا كان ده يدل الحقيقه على يعني حب للاداره، وايضا على ان الظاهر وزاره الصحه كلها متخصصين في الاشعه، وسواء بقى من الاطباء او الفنيين او الاداريين، ودي حاجه الحقيقه تخلينا نفرح كلنا، لان اتصور ان التقدم في مجال الانفستيجيشن بشكل عام والاشعه بشكل خاص هو اللي بيعمل تطور لمهنه الطب بكلها. التشخيص هو جزء اساسي من العلاج، واستخدام النظم التشخيصيه الحديثه والتقنيات الحديثه والتطوير الكبير اللي بيتم على مستوى العالم في نموذج الاشعه هو ده اللي بيقدر يخلينا الحقيقه نبقى ماشيين مع العصر وماشيين مع كل التطور اللي بيحصل. برحب ايضا بالدكتور طارق ضياستي وبهنيه على المنصب الجديد، والجمعيه المصريه انها مشتركه دايما مع اداره الاشعه في وزاره الصحه، وده يعتبر تآخي مهم جدا. والاكاديميا مع كليات الطب واقسام الاشعه على مستوى الجمهوريه مع وزاره الصحه الحقيقه بيطور في عمليه التعليم والبحث العلمي والتدريب. بشكر الدكتور محمد فوزي الحقيقه وكل القائمين على المؤتمر للنسخه الثالثه، لانها من السهل انك انت تعمل مؤتمر، لكن من الصعوبه انك تحافظ على نجاح المؤتمر. وجزء من نجاح المؤتمر بالمناسبه بيبقى مبني على اعداد الحضور. الحضور اللي بيجي دايما بيبقى عنده اغراض انه يطلع على التطور العلمي والنظم التشخيصيه والعلاجيه الحديثه على مستوى العالم، وفرصه وجود معرض ورعاه للمؤتمر اللي هو ايضا جزء من نجاحه، ده اللي بيخلي ان اللي موجودين بيحاولوا يطلعوا على كل ما هو حديث. الحقيقه وزاره الصحه ما بتبخلش ابدا بعمليه يعني شراء والتعاقد على احدث المعدات واحدث الاجهزه، مش بس كده، وعلى تدريب الكوادر على استخدامها بشكل امثل، وكل ده لخدمه المريض. واتصور ان يمكن من كل المستشفيات اللي احنا بنعملها ومشاريع، جزء كبير جدا من تركيزنا بيبقى على استخدام كل التطوير اللي ممكن يحصل في اجهزه تشخيصيه بشكل عام. التواصل ايضا مع الخبرات، والدكتور محمد قال لي الحقيقه ان في حاضرين من الخبراء المصريين على مستوى العالم اللي يعني رحبوا بالاشتراك في المؤتمر، وزمايلنا من الدول العربيه الصديقه والشقيقه اللي موجودين معانا سواء بالحضور او بالاشتراك في ال 26 جلسه عامه اللي هتحصل او ال 12 ورشه عمل اللي بدات النهارده بالفعل. ده الحقيقه بيدي فرصه لتبادل الخبرات وتبادل المعلومات مع كافه الدول الصديقه والمهتمه بالمجال. ايضا الندوات واللقاءات اللي بتتعمل الحقيقه والمناظرات والورك شوبس اللي على هامش المؤتمر بتدي فرصه اكتر للتدريب والتاهيل. وزي ما انتم شفتوا يمكن في عرض الدكتور محمد احنا اهتمينا قوي ان احنا كل الشركات العالميه تبقى عندها اكاديميه للتدريب في وزاره الصحه، علشان نقدر ان احنا نعد بيها دايما الكوادر لما هو جديد. كل سنه بتيجوا بتشوفوا تطوير جديد واستحداث جديد واستخدام تطبيقات جديده زي تطبيقات الذكاء الاصطناعي اللي ممكن انها تغير من مفهوم الطب بشكل عام في الفتره اللي جايه. الحضور اللي انا عرفته ان حوالي 2300 طبيب اشعه وفني ومتخصص في التصوير الطبي والتكنولوجي موجودين، وانا يمكن اشوفهم ان هيبقوا اكتر من كده خلال الايام اللي جايه ان شاء الله. فده كله الحقيقه بيخلينا كلنا نبقى يعني فخورين بالمؤتمر الثالث، ونتمنى دعم ايضا المؤتمر في الفتره اللي جايه. This conference is a testament to the rapid advancement in medical science and technology, and I'm pleased to see this important scientific gathering that has proved its distinguished presence among the international conference by the strong attendance of all our eminent national and international speakers and delegates, as well as our vendor partners working in the field of diagnostics and interventional radiology. Last year, we embarked on our journey to envision the future of radiology. Our focus was on harnessing the power of technology and to revolutionize patients' care. And we, at that time, made significant strides in implementing teleradiology services, deploying mobile CT and MRI units, advancing international and interventional radiology, and exploring the potential of artificial intelligence. And today, as we gather here today, once again, we must continue to push the boundaries of innovation and let us explore the limitless possibilities that lies ahead. We must strive to enhance accessibility, expand teleradiology service to reach the undeserved and unreached populations, advance precision medicine, utilize AI to personalize treatment plans and for individual patients, optimize workflow efficiency by implementing cutting-edge technologies to streamline clinical processes, and to foster international collaboration and strengthen partnership to share knowledge and expertise. By embracing these goals, we can ensure that radiology remains at the forefront of medical progress. As a government, we are committed to provide world-class healthcare to our citizens. Radiology plays a pivotal role in achieving this goal, and it is a cornerstone of accurate diagnosis, effective treatment planning, and monitoring patients' progress. Nevertheless, Egypt now is one of the selected countries to test the new developments in radiology equipments by some of the biggest radiology manufacturers in the world. Along with strengthening the continuous medical education program for the radiology staff and use the simulators in practicing and in practical training. In this regard, a number of new initiatives have been launched for early detection of diseases, including prostate cancer screening initiative and lung cancer screening initiative. This conference provides an excellent opportunity to explore the latest trends and innovations in radiology. By sharing knowledge and expertise, we can collectively elevate the standards of patient care. I'm sure that you all will feel that enriched with the knowledge after completion of this event, and I have no doubt in that, and I urge that all participants to actively engage in the discussions, workshop, and presentations. Let us work together to address the challenges faced by the radiology community and develop solutions that will benefit future generations to come. I would like to extend my sincere gratitude to the organizers and to the sponsors of this conference for their hard work and dedication. I'm confident that this event will be resounding success, and I thank you so much.
جزيل الشكر للأستاذ الدكتور خالد عبد الغفار على دعمه وتشريفه للمؤتمر، والشكر موصول للسادة والسيدات الحضور جميعا. شكرا جزيلا.